Hi, Dr. Modi. I'm Sora Bagheri. I'm a resident physician at Mass Ear at the Department of Ophthalmology at Harvard Medical School. I'm reporting live from the American Academy of Ophthalmology with Clinician Link AI, and I was wondering if you could give us a quick update on home OCT for monitoring.
Yeah, so home OCT, yet to be FDA approved, has incredible promise in our field in the sense that it allows us to monitor patients with exudative AMD. And that gives us the opportunity to reconsider the possibility of treat and extend, extensions way longer than what we would otherwise do. And now we're seeing data from Photon and Pulsar going out to 20 and 24 weeks. And when we go out to these really long extension windows, using home OCT to help us decide when those patients are likely to recur can be really, really valuable. I also think it adds a lot of value in terms of thinking about when to stop treatment. We oftentimes don't think about stopping treatment, and a lot of the data doesn't support stopping treatment. And so I think this gives us the opportunity to follow patients on a day-to-day basis, because remember, 4C Home is approved for non-exudative AMD,
Right.
and this is going to be approved for exudative AMD.
Thank you so much. And would you be able to share any updates on intraoperative OCT with us?
Yeah, so intraoperative OCT is an incredible technology that allows us to really hone in where we have patients who have vitreoretinal interface problems. And I think in those really, really difficult cases where we're thinking about sort of submacular hemorrhage, complex tractional retinal detachment, or maybe ERMs in the setting of vitreoschisis, where we think we have peeled, oftentimes intraoperative OCT allows us to know with certainty, maybe without using additional staining.
Great, thank you for sharing that. And then lastly, I was wondering if you could share any updates on OCT angiography with us.
Yeah, so OCT angiography, I think, provides a lot of value. Specifically, I love it in AMD. I love it in CSR with chronic secondary choroidal neovascularization and identifying those patients, because in those patients, there's a lot of pigmentary changes. There may be window defects from like GA or like RPE dropout. And so when you look at an FA to identify occult neovascularization can be difficult. On the other hand, when you do OCT analysis, you can easily identify type 1 neovascularization and then identify, like, does this person have neovascular disease with or without exudation? And understanding that unique phenotype of AMD allows us to predict who's likely to go on to exudation at a higher rate.
Thank you so much, Dr. Modi, for sharing your updates with us.
Of course.